Hey Mark, thank you very much for being here.
It's a pleasure.
Okay, so today's topic is building modern digital platform for the healthcare, and this area of transformation, of course, is important to have state-of-the-art capabilities, but also having a solution that will put the patient in the center, right? So flawless experiences, really patient-centric approach type of solution. Mm-hmm. Can you talk about a little bit about how you envision that requirement and what kind of capabilities, as Vonage, you bring also in the healthcare market today?
When you look at the telemedicine trends or healthcare or e-health trends over the last years and where we come from, it's all about video. Video is the first one. Obviously, there's all of these platforms that allow us to bring all the data together, and part of that to take the words that you just mentioned is customer experience. Okay, so we're now longer. Before we used to be very data centric, very hospital centric, and now what people are realizing is that it's about the data, right? And it's about bringing all that information to a central place, and it's got to be easy to use for the patients. Okay, so what does Vonage bring as part of that? So everybody's got their speciality. You realize that some people are very back-end platform, and that's key because without that, nothing works. And other people like Vonage are really focused on the communication side. So Vonage is what we call a CPaaS, so communication platform as a service. And what we've seen the most in healthcare is really a couple of things. One is notification, automation with partners like yourself, video, and more generally, everything which goes around security, okay? Because suddenly you're putting people in contact, you're exchanging medical data, and having all of that done in a secure environment is really key. So I think Vonage is really specialized in that, and that from the very start, because even 10 years ago, when we started all this video technology, our first customer was healthcare. And the reason behind it was then in the United States, now obviously within Europe it's slightly different, but then they had a lot of people who wanted second opinions. Okay, so you went to see a doctor, not quite sure what this doctor is, he right, is he not right, I'll go for a second opinion. What you realize is that 10 years later, even more so now, and COVID in the middle, suddenly everything's flipped and people are exchanging on the video. So I think that's really key. Now, if you look from a back-end perspective, video is great, but video on its own is only video. It's only a channel that allows people to get together. So what's important for the end user, be it patients or hospitals, is really how all of that is integrated and brought together. So maybe would you, Marzio, explain to us exactly how you've facilitate this integration and many other integrations in your platform?
Sure. So the way we thought our platform, of course, it's a place where essentially you can find a lot of different capabilities. Integration is key, as you mentioned. So for that reason, we really work hard to provide a number of tools, very easy to set up, also to configure, to extract essentially from the silos-based system that today are still the majority of, the way the system of records were taught and still are deployed, right, so in the healthcare market. And in order to extract those data, of course, we have a number of solutions from, I would say, components that are designed with the intent to get clinical data, right, so in a specific format like H705. Today is the most distributed system in order to interoperate clinical data. Of course, data per se doesn't mean much, as you said, right? So you need to extract value from data and give accessibility in real time to this data. Right? So having additional capabilities, not only to interoperate the data, but also on top of those data, right? So give real-time access, right? So creating specific services where patient and doctor can really find new means of collaborations, right? So is essential today. Going in this direction, Mark, I think flexibility is one of the most important concepts today in the business, of course, but also around the architectural pattern. Right? So having the ability also to create, I would say, new components, but include this component into a meta architecture and configure these components, right? So for the specific intent and business need, or all the user that has to access, right? So to the service that is enabled by the components is fundamental, right? So what is the philosophy behind your components?
I think it's very interesting because, as you said, whether you're in healthcare or another industry, at the end of the day, you need some fundamental pillars. And then on top of that, the complexity for many businesses is that they still have the need to differentiate themselves. Okay, so you mentioned these digital platforms. Everybody doesn't want the same thing, and I think what platforms like yours bring to the table is that they bring they have that underlying best of breed in terms of the various components, and that they can really build the customer experience. We're focused on communication, so we want each and every brand based on the best practices that you have as well. That's your experience and our experience together. We'll bring these best of brands, and then based on that, people can build their own experiences. I think that's really the key differentiator. Within the same country, within a large zone like Europe, everybody's going to want to be slightly different. We'll be focused on a different segment of the healthcare, and therefore they will need that customization. So I think, and I think coming back to your marketplace that you mentioned earlier, I think we're pleased and thrilled to be part of your marketplace. I think today we've done a lot about notification and video. Those are the key parts. But I think what's interesting for you, maybe tell us a bit more about all the other. Have you got a couple of great integrations? Could it be maybe with third-party systems or other types of integrations that you added?
Sure. Yes, of course, interoperability is, as I mentioned in the beginning of this conversation, it's fundamental today, so to provide real-time access to the data or aggregate data, right? So and provide new means around these data. Of course, having, I would say, a means as well to get in contact with patients and doctors or give access to patients to their data. It's fundamental. So interoperability is key. The other key areas are application that we see patients again to the center. So you bring many of these components. So your APIs, so your services around communication are fundamental. So we really believe that providing access to patients, so to clinics, doctors, and all the services. So we, I would say, re-strength. So the nature of healthcare support, so after the COVID period, so really patients, they want to embrace, so their clinical situation, so they want to be aware, so what is really, so their needs around healthcare, so and they want to have the access to the best solution that the market will offer. So it's remote, so it's in person, so it doesn't matter. So digital is a tool that will, of course, so together with all the capabilities that we offer, so provide a new way to personalize more the medicine, so based on the patient needs. So having the patient at the center, personalization of the medicine, really having access to the data, so and decide about accessibility, of this data or usage of these data today is fundamental for the patients. Therefore, we as a vendor, so we work with the healthcare provider in order to build a solution that really will get so these patient centricities so back into the healthcare system.
Everything is being digitalized, and obviously COVID pushed that massively. We went from 1 to 10 during COVID, and now what we're seeing is that those trends have actually stayed very high. We're keeping along those lines, and people have really embraced, and it's completely changed. Even in some various countries in Europe, they haven't all moved at the same speed, but now we're seeing that as a whole, everybody's embracing all these things. So I think one other thing which is interesting, John, your last topic was all about the notion of data and gathering data. And what we're seeing also is that we've got more and more customers and kind of niche actors who've really decided, on top of apps and APIs, the big thing that's changed everything here, because the ability to update information everywhere is key. But with the use of apps and also the use of other notifications like simple things like SMS, in order to gather data, surveys, survivability rates, all of that data plugged back in is a mine of information.
Yes, absolutely. And I just want to add one last piece, right, so to this wonderful picture that we paint together. Right, so when we discuss about technology, but it's really about, I'll say, awareness of people at the end. Right, so it's make, I would say, all these components really human-centered, right? So with the flowless experience, right? So it's a doctor, it's a patient, so all this technology, right? So they need to enable this patient journey, right? So the best flowless experience, right? So using digital, right? So using the existing system, using also digital, right? So, but all together they need to be orchestrated, right? So, and provide this, I would say, patient centricity and digital medicine, right? So that is really key, right? So for the digital transformation of the healthcare market today.
Excellent, Marzio. Thank you a lot.
Thank you, Marc.